It's only less than 50% of the care that is the medical aspect of it. The rest of it is the psychological condition, the fears, the feeling that I've been left alone because the hospital has discharged me. And that is where we step in and we start looking after a patient, treat the family as a unit, because mutually they know that the end might be approaching. In these 20 years of Karunashramam's existence, we've often wondered what made us choose the name. And in retrospect, I think it follows that Karuna Ashraya, abode of compassion, fairly describes the type of care we've been able to give to our patients and their families and the condition in which life has ended for them.
Here we provide free of cost service only to advanced cancer patient. Here is a team, everybody is together. In hospital setup, palliative care is like a department there. They don't have fixed nurse or counselor or nothing. To getting them together is a big issue there. We have everything.
There are other aspects of care. You care medically, you care psychologically and emotionally. Loved one suffers right along with the patient, seeing their pain or what emotional fallout is there in the family itself. So it's a respite for them too. See, if they were not resistant in the beginning for the infusion, it would have been much better. It would have been much more calmer.
Palliative care is actually all about teamwork. It has to be a team of doctors, of nurses, health assistants, of counselors, of physiotherapists, and including the administrative staff over here. Without all these people working as a team, it's not possible to give good quality palliative care.
ಯಾವುದೇ ಒಂದು ಪೇಷಂಟು ನಮಗಿಂತ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಗಳನ್ನೇ ಜಾಸ್ತಿ ಕೇಳೋದು. ಏನಕ್ಕಂದರೆ ಅವನಿಗೆ ಏನು ಬೇಕು, ಏನು ಬೇಡ, ಯಾವ ರೀತಿ ಆ ವ್ಯಕ್ತಿ ಇದ್ದ, ಮತ್ತು ಇವಾಗ ಯಾವ ರೀತಿ ಇದ್ದಾನೆ, ಮತ್ತು ಮನಸ್ಸಿನಲ್ಲಿ ಯಾವ್ಯಾವ ಭಾವನೆಗಳು ಅವನಿಗೆ ಇದೆ ಅನ್ನೋದು ಗೊತ್ತುಪಡಿಸೋಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ. ಪೇಷಂಟಿಗೆ ಇದು ಹೊಸ ಜಾಗ, ನಾವೆಲ್ಲ ಹೊಸಬರು, ಜೊತೆಗೆ ಇಲ್ಲಿ ಯಾವ್ಯಾವ ಥರದ ಜನ ಇದ್ದಾರೆ ಅನ್ನೋದು ಅವರಿಗೆ ಗೊತ್ತಿಲ್ಲ. ಅದರಿಂದಾಗಿ ಫಸ್ಟ್ ಅವರಿಗೆ ಕಂಫರ್ಟಬಲ್ ನೋಡ್ತೀವಿ, ಬಾತು, ಒಳ್ಳೆ ಬೆಟ್ಟು, ಜೊತೆಗೆ ಅವರು ಏನಾದರೂ ಕೋಪ ಮಾಡಿಕೊಂಡ್ರು ನಾವು ಕೋಪ ಮಾಡ್ಕೊಳಲ್ಲ, ಏನಕ್ಕಂದರೆ ಅವರಿಗೆ ನಾವೇ ಎಲ್ಲ.
One of the important factors is because of the number of deaths that we see over here, there is a great deal of stress, mental stress for these caregivers, and therefore we have many ways in which we try to overcome this stress.
Nurses should be a motivating channel, because even if the medical team, everybody is there because we are directly involved in that. Very especially young people, maybe not expected age a person to say goodbye to them. Such places, it's really difficult. Sometimes our eyes are sweating. Human beings should be always respected, whether anybody see or whether they are conscious. I always teach them, because if they are unconscious, that does not mean that their dignity should not be respected. All of us live and all of us die. Nobody is going to be immortal here. But at least we feel that when people die, they die peacefully here. They do not die in suffering. They do not actually die without dignity. And nobody dies alone, because the greatest fear I think most of us have is dying alone. That is something I think we are able to give support for our patients here. That's exactly what Karunashramam is all about. It's not just about the treatment, it's about the patient, it's about the family. It's also about bringing all of them together.